This conference will now be recorded.
So, hi, a very good morning to one and all. So, welcome to the day two session of the webinar. And yeah, we have our first presenter again, Dr. Huang Wei Ling from Medical Acupuncture and Pain Management Clinic, Brazil. So, Dr. Wei Ling, are we ready for the presentation?
I am going inside the conference because I
Okay.
have one problem in my computer, but
Mm-hmm.
I'm ready to present.
Okay. So, do you want me to give the permissions for the one that you have logged in with Wei or with Huang Wei Ling?
Let me see. Let me see.
Yeah,
I think
sure.
it's Huang Weilin.
Mhm. Oh, yeah, the one with which you logged in for Huang Wei Ling is showing offline, and I just couldn't
Yeah,
make you the
that's
present.
why. That's
Oh,
why I'm going inside now. Yeah.
acha, okay, okay, I got it. Maybe you can just log out and log in once again.
No,
Yeah,
I'm
now,
here now. Now it's okay.
yeah, we got it.
Now you can you allow me to share the screen?
Yeah.
Okay. How can I do? How can I share? Here.
Yeah, you can just open the PowerPoint presentation.
Mm, let me see.
Yeah.
Mm, um,
Just
let me see.
minimize the Chrome window. Yeah.
Can you see?
Yeah, we can see it.
Yeah. Oh. Mm. Okay.
Yeah.
Okay, I will begin the presentation. Okay.
Yeah, sure.
Good morning, good afternoon, or good evening to everyone. My name is Huang Weilin. I'm a medical doctor from Brazil, an infectious disease specialist. I would like to thank the organizing committee to inviting me to this conference to share this study today. This study is entitled, Are We Vaccinating Immunocompetent or Immunocompromised Patients for COVID-19? In a recent decade, several new diseases have emerged in different geographical areas with pathogens including Ebola virus, Zika virus, and other virus. And recently, a new type of virus infection emerged in Wuhan, China. And initial genomic sequencing data of these virals do not match with previously sequenced COVID, suggesting a novel COVID strain, which has now been termed severe acute respiratory syndrome COVID, SARS-CoV-2. Vaccines are a powerful tool to counter infectious disease threats with pandemic potential. The development of the experimental vaccines require a plethora of molecular techniques, as well as a strict compliance with safety procedure. And the research and clinical data integrity, cross-validation of the results, and appropriate study from the perspective of efficacy and potential side effects have recently become discussed topic. In this article, 2020 Race Towards SARS-CoV-2 Specific Vaccines, written by Thomas et al., they present an update on latest advances and progress in an ongoing race to develop 52 different vaccines against SARS-CoV-2, focused on registered clinical trials until November 2020 that fulfill the international safety and efficacy criteria in the vaccine development. And more than 103 clinical candidates to vaccines against SARS-CoV-2 should meet at least the following requirements that need to minimize undesirable immune potentiation and be suitable for adults healthcare workers and be suitable for adults more than 60 years old or with underlying diabetes or hypertension and be suitable for long-term stock killings. And these 52 vaccines, including 13 protein subunity candidates, 11 non-replicating viral vector vaccines, 6 inactivated, 6 RNA, and 4 DNA vaccines, 4 replicating viral vector, and 2 virus-like proteins, and 6 others. There are advantages and the disadvantages to each vaccine's platforms. Viral vectors vaccines exhibit potential risks such as chromosomal integration and oncogenesis, and generally cannot be used in immune-compromised subjects. And protein vaccines need adjuvants to enhance immunological response. At the same time, global-scale deployment of attenuated vaccines is always associated with the risks of pathogen reactivation and regaining its virulence in the future. At present, every vaccine's technology represents a compromise between good efficacy, safety, and a lack of side effects. According to CDC, Center of Disease Control and Prevention in the United States, 2 vaccines are authorized and recommended to prevent COVID-19 is a Pfizer BioNTech COVID-19 vaccines and Moderna's COVID-19 vaccines. These both vaccines are made by RNA. And the European Medicine Agency has recommended the Pfizer BioNTech coronavirus vaccines for use in the bloc's 27 states. According to the CDC, these 2 vaccines are indicated to all the population over 18 years of age, except for those who had allergic reactions to polysorbate or any other component of the vaccines, as well as allergic reactions after the first dose. Immune-compromised individuals can receive COVID-19 vaccination if they have no contraindications to vaccination. However, they should be counseled about the vaccine's non-safety profile and efficacy in immune-compromised population, as well as the potential for reduced immune response and the need to continue to follow all current guidelines to protect against COVID-19. Antibody testing is not recommended to access immunity to COVID-19 after vaccination with COVID-19 RNA. In Western medical theory, the immune system has an extensive defensive function, and the cells of the immune system work together with different proteins to seek out and destroy anything foreign or dangerous that enters the body. According to Andrea Cortegiani et al. In the article Immune-compromised patients with acute respiratory distress syndrome, secondary analysis of the lungs safe database, immune-compromised patients are defined as all patients with at least one of the following conditions. Immunosuppression, defined as viral immunosuppression, neoplastic disease, immunosuppressive drugs, including steroids, chemotherapy, or congenital immunosuppression, or active hematologic malignancy, such as that patients that still requiring treatments, and active neoplasms, such as the neoplasm that has not been resected, still requires treatment or with metastasis. And patients without these conditions were classified as immune competent. According to the Canadian Immunization Guide, immune-compromised persons are more susceptible to vaccines-preventable infections and may have severe infections. And the safety and effectiveness of vaccines in immune-compromised persons are determined by the type of immune deficiency and degree of immune suppression. Each immune-compromised person is different and present unique considerations regarding immunization. And the relative degree of immune deficiency is variable depending on the underlying condition, the progression of the disease, and use of immune suppressive agents. Immune deficiency can also vary over time in many people, and the decision to recommend for or against a particular vaccines will depend upon a case-by-case analysis of the risks and benefits. And there is a potential for serious illness and death if immune-compromised people are under-immunized, and every effort should be made to ensure adequate protection through immunization. However, inappropriate use of live vaccines can cause serious adverse events in some immune-compromised people as a result of uncontrolled replication of vaccines, virus, or bacteria. But this study I am bringing to you today is I'm showing a different point of view about the population we have nowadays in our world due to a Hippocrates code that said that it's important to consider other ancient medical tools prior to the knowledge we have nowadays. So I will show to you how our population are in different point of view of traditional Chinese medicine. Chinese medicine never discussed immunity directly. Instead, described the clinical symptoms of the body response to an invasion of the external pathogens in terms of Zhen Qi, That's the vital qi, which protects the human health by fending off invasion. In the editorial entitled Acupuncture and Immunity, written by Feng Xiaoliang et al., they showed that more and more research has revealed that acupuncture can regulate immunity, for example, to enhance anti-cancer and anti-stress immune function and exert anti-inflammation effects. This may be the basis of acupuncture in preventing and treating later disease. Moreover, traditional Chinese medicine focuses on the theory that prevention before the onsets of the disease or intervening in an early stage of the disease is much better than treating after the onset. And to better understand the type of people we have nowadays, I did a research in my clinic between 2015 to April 2020, measuring the energy of my patients through the radiesthesia procedure. That is done using a crystal pendulum positioned in front of each chakra, followed by the analysis of the pendulum movements to measure the energy of these patients. And the energy of the chakra is evaluated in a scale to 1 to 8, 1 representing the lowest level and 8 the normal level. And I measured the chakra's energy of 1,000 patients, but I was only able to analyze and compile the files of 409 patients. Each chakra corresponds to a functioning of one of the massive organs in traditional Chinese medicine. And one organ is responsible for one external sensorial organ in TCM. As you can see, this is chakra 1 to 7. The 1 represents the wood in the 5-element theory in TCM and represents the liver. The 2nd represents the water element and represents the kidney. The 3rd represents the fire and corresponds to the heart. And the 4th corresponds to the metal element and is the lung. And the 50th chakra is the earth element, corresponds to the spleen. And each massive organ is responsible for the production of energies to maintain the health of the human. For example, the spleen is responsible for the absorption of nutrients and the production of blood, and the heart is responsible for maintaining the blood vessel flowing inside the vessels, and the kidney is responsible for the production of yin and yang, and the liver and lung are responsible for the production of qi. And in this study, I'm showing you that in the analysis of my patient, in this study, I'm showing you that the majority of the patients, 70% were in this classification. They have energy only in the spiritual chakra, that's the 7, but all massive organs in TCM were in the lowest level of energy. This means that the energy means immune system. This means that the immune system of all my patients that I'm treating, they are including the children, the adolescents, the young adults, and the older patients. They all are they don't have energy in any of the chakra, and this means that their immune systems are all compromised, and not only patients that have cancer diagnosis or diabetes or hypertension. They all have common diagnoses such as anxiety, depression, headache, knee pain, low back pain, insomnia, all kinds of diagnoses in Western medicine. They have energy disturbances that are the energy deficiencies leading to these manifestations. And also in this group corresponds to 20%. In this 20%, they don't have energy even in the second chakra. And what we have in this group is that when they don't have energy in the seventh chakra, the energy imbalances between yin and yang blood are more complicated because they have more internal heat since in children, in adolescents, but in this group that they have this spiritual chakra, they have internal heat only in the oldest group. This means that when you don't have this spiritual chakra, you can have more complication. This study will be published in the study that I am publishing about this alteration leading to a complication and propensity to have SARS-CoV-2 infection nowadays and other chronic disease, because in traditional Chinese medicine, all chronic disease comes from the energy imbalances and deficiencies, mainly cancer formation, but also diabetes, hypertension, myocardial infarction can come due to energy deficiency and imbalance. And in this chart, I'm showing that the 11% that remaining that are not in the table 1 and 2 that I showed to you, they have energy in some of the chakra, but they don't have energy in other chakras too. The traditional Chinese medicine literature understands the Zen Qi as the ability of the organism to protect itself from the influences of the external pathogenic factors. That SARS-CoV-2 is considered an invasion of the external pathogenic factor that comes from outside, and exposed in the tree metaphor that I will show you. The ability of the organism to recover after damaging influences or energy imbalances caused by emotional distress or bad eating habits. And Zen Qi is formed with the constitutional energy of the kidney meridian and is part inherited from the parents and part acquired from diet and other factors. And TCM refers to all pathogenic factors as a malicious energies or qi. In this slide, I'm demonstrate that when the patient has a normal Zen Qi, that normal energy protecting, the qi that is the external pathogenic factor invading the body could not have any problems in this patient, but the patient that has a low Zen Qi, that is the majority of the patient that I am attending in my clinic, and I think this sample that I have in my clinic is not only in my clinic, but I think this is happening all over the world, in our population, in our countries, because this reduce and key could be caused by the influence of all the electromagnetic waves that I will show you in my next presentation. These are the yin, yang, qi, and blood. The relationship between them are very important to maintain health of the patient. And if all these energy are deficiency inside the body, the propensity to have serious disease or complications will increase. And that's why the yin and yang in this presentation is produced by the second chakra or the kidney, that I show you that all the patients that I'm attending, they don't have this energy to produce yin yang, and the blood is produced by the fifth chakra that's already low in all the patients, and the qi is produced by the balanced state between yang and blood, and is regulated by the first chakra and the fourth chakra, that is the lung and the liver. and that is all in the lowest level of energy. Here I'm showing you that what I said. The second chakra is the chakra responsible for the production of Zen Qi. The Zen Qi is the ability of the organism to protect against the invasion of the external pathogenic factor. And as I show you, my patients doesn't have Zen Qi adequately to protect them against the invasion. And that's why we are seeing that the COVID-19 infection nowadays is not only in the immune compromised patient that's cancer, diabetes, or hypertension, or other patients that's taking immune suppressive medication. But we are looking at all the patients, including young adults and adolescents and many other kinds of patients, are having this kind of infection and severe complications due to this lack of energy in the chakras energy centers. Although we do not find articles in the literature discussing some cases of deaths that we saw in the journals or in the magazines, it's known though through social media, newspapers, or other sites around the world that in several countries, people are already being vaccinated. There are people said to be healthy. They are dying after being vaccinated. So are we not underestimating our immune-compromised population? Are our immune-compromised much bigger than we think they are? Immune-compromised people are not only those who have HIV or diabetes or cancer or are immune-suppressive. For this study that I have done, patients diagnosed with anxiety, depression, panic syndrome, back pain, knee pain, headache, diabetes, all are in the group of immune compromised because everyone's energy is very low. According to Andrew Clark et al. In the article Global, Regional, and National Estimates of the Population at Increased Risks of Severe COVID-19 Due to Underlying Health Condition in 2020, a modeling study estimates of the number of the individuals at increased risks were most sensitive to the prevalence of chronic kidney disease, diabetes, cardiovascular disease, and chronic respiratory disease. However, this study cannot capture the global diversity of patterns of multimorbidity, which will differ in regions where, for example, there are high prevalence of HIV or sickle cell disorders. In the article entitled Epidemiological and Clinical Characteristics in 99 Cases of 2019 Novel Coronavirus Pneumonia in Wuhan, China, a descriptive study published by Chen et al. At the Lancet January 2020, they showed a study with 99 patients in a hospital in Wuhan, China. And the patient described in this article already had comorbidities such as chronic medical illness, cardiovascular and cerebrovascular disease, digestive system disease, endocrine system disease, malignant tumor, nervous system disease, and respiratory system disease. And the evolution of these patients to acute respiratory distress syndrome were 17%, acute renal injury 3%, acute respiratory injury 8%, and I have some articles regarding cancer. In one of them entitled the importance of treating energy imbalances and chakras replenishment for prevention and treatment of cancer, published last year. I demonstrated through 3 case reports that cancer patients have energy deficiencies and heat retention at the root of this problem, and also chakras energy deficiencies, as I showed you in this presentation, in the lowest level, and the balance of energy deficiencies and taking out the heat retention associated with replenishment of these energies is important to prevent and treat cancer patients. I have 2 other articles regarding cancer energies and chakras replenishment in prevention and treatment of patients with atypical PEP cell exams and chakras energy deficiencies as one of the cause of kidney cancer. In this first, I showed that patients with atypical cellular results in a PEP smear exam can be normalized with correction of the woman's body energy disturbances and using Chinese dietary counseling, auricular acupuncture, apical bloodletting as a tool in TCM treatment for the correction of energy disturbances and replenishment of the chakras energy deficiencies using highly diluted medications such as homeopathy medication. And in there is a sound in the background. Can you turn off your speaker, please? Yeah. And in the second, I demonstrated that one possible cause of kidney cancer development could be the chakras energy deficiencies. And the replenishment of the chakras energy is very important to recover the energy of the patients that is leading to cancer formation, preventing for metastasis, and also the generation of other kinds of chronic disease or other cancers in other sites of the body. In another 2 articles entitled Energy Imbalances and Chakras Energy Replenishment to Treat Patients with Urinary Incontinence and Sexual Dysfunction Post-Cancer Prostatectomy, and after energy alterations and chakras energy deficiencies as the main cause of radiation-induced rectal bleeding prostate cancer patients, I showed that patients with urinary incontinence, sexual dysfunction, and rectal bleeding post-cancer prostatectomy have energies imbalances and chakras energy deficiencies as the root of the problem, of all this problem. And the treatment rebalancing these chakras energy centers with high diluted medication is crucial for the recovery of the symptoms presented after this surgery. I presented a study entitled Chakras Energy Deficiency as the second cause of immune deficiency in HIV patients in HIV/AIDS is the infectious disease in healthcare webinar on November 23, 2020, where I demonstrated that patients with HIV and treatment with antiretroviral therapy and other kinds of medications have chakras energy deficiencies, and the treatment of these deficiencies are important to improve their immune system. In all these publications made by me, written by me, in diabetes patients, in patients with recurrent urinary tract infection, patients with chronic constipation, in patients with gestational diabetes and diabetes, all patients with any chronic disease or any are in the lowest level of energy. And that's why I'm saying that all these patients are considered immune compromised, because energy means immune system in TCM. As you saw in the table before presented, I'm showing that the majority of patients that had chakras energy deficiencies had common diagnoses such as anxiety, depression, headache, knee pain, low back pain, and are not considered nowadays at risks of acquiring SARS-CoV-2 infection. But in this study, I'm demonstrating that the majority of patients are in the risks of acquiring SARS-CoV-2 infection due to this lack of energy leading to the lack of immune system. In this slide, I'm showing you the same case I treat in my clinic of these patients that aren't considered immune compromised by Western medicine, such as patients with anxiety, patients with knee pain, patients with depression postpartum, patients with insomnia, all these patients, panic syndrome, all these patients are published in this article have chakras energy deficiencies, and this means that it is all they have in common are these deficiencies in energies considered immune compromised and not immune competent. And another important consideration concerning this study is that all patients who were not characterized as immune compromised can also be considered immune compromised, because according to my experience, 6 or 7 years ago, patients were not in the same energy situation. People had energy in their organs. There were few people who they have no energy at all, but the majority of the patients years ago, they have energy in the chakras energy. And what I see is that in the last 5 years, everyone has no energy in their chakras. And a talk from Thomas Cohen, a medical doctor from USA, states that SARS-CoV-2 infection may be related to 5G technology, and the 5G technology started to be implemented in 2018, but all the electromagnetic waves are believed to harm the energy. And it is possible the 5G are related to the lack of energy of the chakras on the majority of the population that I am attending, but I think this situation is not only considered in my clinic, but it is, I think it's in the whole world. But what we need to do now is try to begin to measure the energy of this patient to see if what I'm saying is true or false. In publication regarding the possible harmful effects of the electromagnetic waves in the literature, what I noticed is that the study that conclude that these energies cannot induce harmful effects on the human body, they did not study the energy of the patients in the majority of them. And that occurs because the energy level cannot be seen by the naked eye. In this article, did wireless telegraph and telephony causes the emergency of epidemic poliomyelitis? In this article written by Vicente Lauer, the author is showing that the time coincidence of poliomyelitis epidemiology, electromagnetic waves emission, together with the evolution of the virus of polio, bring strong support to the hypothesis that exposure to electromagnetic fields triggered both epidemic poliomyelitis and the diversification of the virus of polio. And another article in this article relating the radio frequency radiation including 5G should accessed by experts, no conflicts of interest. Because in this article they are saying that people are not they are affirming that the lack of proper risks evaluation of 5G technology. There are some studies that was not pointing that this 5G could be affecting the human body. But in this article, they are saying that there are cartels of individuals monopolizing the committee to study this field, reinforcing always the no risk paradigm that occurs in this situation. But in this article, they are saying that this should be considered as scientific misconduct. But what I want to say in this table is a progression from health to disease, that there are 5 phases from this progression. The first 3 phases, the human body has energy alteration, but the exams are still normal. And Western medicine usually do the diagnosis only in the phase 4 and 5, when there are some alteration in the laboratory exams. But when the patient has complaints that the laboratory exams are normal, this does not mean that the patient do not have anything. They have energy disturbances and are in the energy level, and you cannot see. And I'm showing you that when you do some laboratory exams and the exams are normal, such as an ultrasound of the kidney, for example, you can have that the exams are normal here. Oh, all these 2 batteries are normal, seems normal, but one battery is normal, is full of energy, and the other one don't have energy, and that's the difference. One works and one cannot work. And in this slide, I'm showing you the what Brazil could spend if give vaccines, Pfizer, Coronavac, or when this country give a homeopathic medication to all the population to prevent this infection. And here are the costs of each, if they give each vaccine or give this kind of medication, because this medication is very cheap and can protect not only this virus, but the other kinds of infection, because they can induce the more Zenki production. And here is to showing you that to have this, to know if we are vaccinating immunocompetent or immune compromised patient, we have to have in mind the 2 kinds of medicine to understand in the deeper way of reasoning the Chinese medicine and Western medicine to understand the energy level. And the conclusion of this study is that to vaccinate people from COVID-19 nowadays, it's important to analyze the energy of each patient before doing this vaccination. And according to this research by the author, more than here 97% of the population were in the lowest level of energy and has no energy on the Zenki, that's the energy protecting against the invasion of these external pathogenic factors. And for everyone can be considered immune compromised and not immune competent. And according to Hippocrates, disease was a natural process, that the signs and symptoms of a disease were caused by the natural reactions of the body to the disease process. And that is why this COVID-19 infection, this complication and all these reactions are the reactions of the body against the invasion of these. But as I show you, as the majority of the people nowadays are immune compromised, they are having this evolution in COVID-19 because of this lack of energy. That this is the other publication that is I'm publishing this month to explain all these alterations in these immune compromised patients in the energy point of view, and what we need to know to don't harm even more this energy that's already low. Thank you for your attention. If you have any question, I will be very, very happy to answer. Thank you.
Thanks a lot for your presentation, Dr. Wailing. It was really informative and very neat. So yeah, do we have any questions? I hope there are no questions as no one is, yeah. So we really appreciate your patience and your interest towards attending the webinar, and we are thankful for your presentations. Thanks a lot.
You're welcome.
Yeah, thank you. So moving on to our next presentation, we have the presentation from just a bit of rescheduling the presentation. So we have the next recorded presentation from Dr. Chandrika Johnson of Fayetteville State University, USA. So we just have a recorded presentation. So we are just going to play that off.
This is included 34.1 million adults. My name is Chandrika Johnson. The title of my presentation is Assessing Diabetes Knowledge, Attitudes, and Behaviors of College Students. Diabetes is one of the nation's most prevalent and deadly diseases and is the seventh leading cause of death in the United States. It is a significant health problem in the United States, affecting 34.2 million people, or 10.5% of the United States population, had diabetes, diagnosed or undiagnosed in 2018. This total included 34.1 million adults aged 18 years or older, or 13% of all United States adults. About 7.3 million of these adults had diabetes, but were not aware that they had the disease or did not report that they had it. The prevalence of prediabetes is increasing in the United States among adolescents 12 to 18 years old and young adults aged 19 to 34 years, which puts them at increased risk of developing diabetes and cardiovascular diseases. Despite the advance in knowledge to prevent diabetes, undiagnosed, undertreated diabetes remains a significant problem. Diabetes is associated with an increased risk for a number of serious, sometimes life-threatening complications, and certain populations experience an even greater threat. Good diabetes management can help reduce the risk of diabetes. However, many people are not even aware that they have diabetes until they develop one of its complications. Diabetes can be prevented by losing a modest amount of weight, getting 30 minutes of physical activity 5 days a week, and eating healthy. People with prediabetes can delay or prevent an onset of the disease. Prediabetes is blood glucose levels that are higher than normal, but not yet high enough to be diagnosed as diabetes. College students may be at risk for prediabetes because of their health practices and lack of medical checkups. It is very important to target college students because it has been found that 70% of individuals in this population tend to gain weight during their first year of college. Because the association between elevated BMI and diabetes is well established, college students are overweight or obese, and those with prediabetes could benefit from diabetes education. By the same token, college students who are not overweight or obese could also benefit from diabetes education because it has been reported that individuals in this population often engage in poor nutritional practices and frequently lead sedentary lifestyles. It has also been noted that by the end of the senior year of their undergraduate year, the prevalence of obesity among college students increases markedly. Being a college student and trying to make
Hello.
living a full life as a college student with diabetes is possible and manageable, but requires extra precautions. It is very important that young people, as well as college students, to be well informed about the risk factors, preventive measures, complications, and therapeutic interventions of diabetes, especially type 2 diabetes. The purpose of this study was to evaluate a survey instrument to assess diabetes knowledge, attitudes, and behaviors of college students enrolled in a health education introductory course. Researchers used a qualitative research design. The instrument used for data collection was a 33-item survey, including questions related to the college students' knowledge, attitudes, and behaviors about diabetes. Total scores were calculated for knowledge of diabetes and attitude towards diabetes. Descriptive analysis were used for questions related to behaviors. The survey consisted of 4 demographic questions, 12 multiple choice formatted questions, 7 true-false questions, and 10 Likert scale questions. Questions dealt with topic areas about diabetes. Students were asked 7 questions relating to their behaviors or likelihood of behaviors regarding checking glucose levels, exercising, and visiting the doctor. 12 survey items were used as indicators of parent knowledge. These questions asked about types of diabetes, blood glucose levels, and prevention factors. Attitudes regarding diabetes was assessed through questions. In regards to the sample, a sample of convenience was used for this study. Participants were recruited, as I stated, from Foundations of Health courses in the Health Education and Recreation Department. They were informed that their participation was completely voluntary and confidential. Students was asked to complete a knowledge, attitude, and behavior survey, which was administered by the researchers with permission from the instructors of the classes. The 3 classes used were randomly selected from a pool of 5 classes. The pool consisted of undergraduate students enrolled at a public 4-year degree grant institution in southeastern region of the United States. 60 survey questions were returned and used for this study. The results consisted of 60 college students responding to the survey. The knowledge subset produced a KR20 coefficient of 0.277 for the knowledge questions. A group mean of 9.27 was found for the knowledge questions, with a standard deviation of 1.48. The knowledge questions show no statistical difference between genders. There were 2 questions with statistical differences found between race and ethnicity at the 0.01 and 0.05 levels. Cronbach alpha was performed on the attitude and behavior data. A score of 0.87 was found for the attitude items and a 0.172 for behaviors. There were statistical gender differences for student attitudes towards diabetes for 1 item. There was no statistical difference found between race and ethnicity for attitudes towards diabetes. There were no significant differences found between the genders or race ethnicities for behaviors. In conclusion, while results of this study are limited by the small sample size and data collection in only 1 university, participants in this study attitudes regarding diabetes was great. Further studies should include a larger group of participants with more diverse characteristics, observing different populations at different universities. Thank you for your time and listening to my presentation. If you have any questions, I can be reached at my email, and my email address is chjohnson01@uncfsu.edu. My name is Chandrika Johnson, and I can be contacted by email again at chjohnson01@uncfsu.edu. Have a great day.
So that was all with the presentation from Dr. Chandrika Johnson. So yeah, now let us move to our next presentation by Dr. Dulpreet Singh. Dr. Dulpreet Singh from ISF College of Pharmacy, India. Dr. Dulpreet Singh, are we ready? Dr. Dulpreet Singh, are we ready for the presentation?
I'm online. I am saying hello, but no one is saying I'm online.
Okay, yeah. Yeah, now we can hear you.
Hello,
Yeah, now
hello.
we can hear you.
Okay. This is good.
Yeah.
And hello.
Yeah. Can you see the PowerPoint presentation?
Ma'am, I can see the screen.
Yeah.
Uh, but first, can you introduce to all the participants?
Yeah, I actually then you haven't listened. I'm so sorry. So yeah, now we have our next presentation from Dr. Dilpreet Singh from ISF College of Pharmacy, India. So yes, doctor, we can have the presentation on the topic interlinked mechanisms of vitamin D levels and COVID-19 susceptibility. So yeah.
So good evening to everyone. So myself, Dr. Dilpreet Singh, at working as an associate professor in ISF College of Pharmacy, Moga. It's a COVID-19 is a pandemic, and it's an outbreak in the world, and it's hello.
Yeah, we can hear you.
Even the presentation is not movable. So whatever
I
method
okay.
I can show
I,
this.
I will move it for you. I'll be doing that for you. You can just say next slide so that I'll move that.
Okay. So the
Yeah.
COVID-19 pandemic is outbreak is I think it's a terrible disorder. So it's a terrible disease. So it kills around multiple people, so million times of the people. So it's a terrible problem in the world that facing presently. So what we can, there is no treatment or drug is available for the treatment of COVID-19. But what I literature are based upon that I've published around 5 or 6 papers of COVID-19, that that vitamin D, that is present active form is vitamin D3. It's a metabolite that responsible for the generating adaptive and innate immunity in body. So it have to fight the viral application, and it does not spread into the body. So I have discovered that the vitamin D supplementation is very important to maintain the immunity as well as to generate the overall immune response. So, madam, please share next slide. I already said that the very third wave of the coronavirus infection has swept the world and it brought to the knees. It's very obvious that it all the people have been suffered from the disease, and they have billions of people. They are into the home, or some people are homeless because they have not they have been destroyed financially because of COVID-19. So the COVID-19 is firstly originated in the Wuhan. Already the audience know that. So currently no treatment and available through vaccine development is under progress. So this have researcher that led to many researchers and clinicians. They are working day and night for alternative or any drug properties that can lower the mortality rate. So but what researchers have found that the vitamin D is we already know that it's a fat soluble vitamin that play a major role in calcium hemostasis. It is synthesized endogenously in the skin when exposed to UV radiation in sunlight. So what we discussed in this presentation, that what are the correlation, actually what are the interlinked mechanisms of vitamin D levels in generating a immune response which fight the viral application in the body, and it protect us from many viral infections like I'm not talking about the COVID because COVID is also a viral disease. Many type of like SARS, CoV2, severe acute respiratory syndrome. So there are many type of the viral application which have the fight for vitamin D. So in this presentation we have discussed the mechanisms. What are the mechanisms that interlinked correlate between the vitamin D as well as the COVID-19? So next slide. So I already discussed that the vitamin D is a immunomodulatory element. So I have this presentation, this slides, it shows the, because I have reduced the maximum text rate because I am short of time. So I have prepared a few animation or pictures which we have to learn about the what are the actual mechanism or what are the actual mechanism that is responsible for the immunomodulatory effect of vitamin D. So vitamin D, we also know that in the phagocytes there is a receptor called VDR or TLR, that is a toline-like receptor, which activated in the we taken the vitamin D, because vitamin D3 is an active form of vitamin D which activate the TLP-like receptors in the phagocytes, and the phagocytes, it will activate the DEP4 mechanism, that is a pathway, that is the dooctyl ethylene follicum bromide 4. That is a type, it is a pathway, biological pathway that it increase the calcilycidin, and it also improve the nitric oxide release. So nitric oxide release is also has a property to decrease the halicin. Halicin is also a immunomodulatory agent. So it will decrease the halicin. It will, so it will, it, if the decrease in the halicin, it shows the insertion of the ferric ions. So the ferric ions insertion is broadly maintained by the ferroportin in the phagocytes. So the ferroportin phagocytes is responsible for the destruction of pathogens. So this mechanism induces the transcriptional induce of alpha-1 hydrolase, that is the cytochrome enzyme, and vitamin D3 receptors. The VDR receptors, basically the main picture is the VDR receptors. The VDR receptors, that it gives activation of this VDR receptor, it gives innate immunity and adaptive immunity to the patients, which also hospitalized, and it get cured for some period of time. Next slide, ma'am. So this is vitamin D and the host immune system. I have previously discussed that the TL receptor, it activates in the phagocytes, and it also activates VDR receptors. So the if also known as the, if we suppose that the SARS-CoV-2 is an antigen present in the body, and it activates the ACE2 enzyme, which leads to a destruction of macrophages. Macrophages destruction lead to decrease the production of IL-1, IL-6, and TNF alpha protein, which activate the alveolar pneumonocyte apoptosis. Pneumonocyte apoptosis induce it like cytokine storm. This cytokine storm is the major mechanism for death in the patients with COVID-19. The cytokine storm is, I think, like the storm of cytokines, like the destruction of cytokines in like the, we fire the bullet by the this automatic gun, it's fire like this, and it's like the cytokine storm in the body, so it will no, body will not be tolerated, and so the proper respiratory distress syndrome is observed. So vitamin D is immunomodulator, which has to reduce the VDR receptors. VDR receptors, it augments the modulated gene expression of these cytokines, and it reduces the NFB kappa or pro-inflammatory cytokines, which have anti-inflammatory properties. It also reduces the T cell proliferation, Th2 shift or Th2 humoral cytotoxic responses. It also increases the nitric oxide response, lysozyme enzymes, TLR expression, and also it reduces the beta definition protein, which the major mechanism to improve the innate immune response, and it shows the virucidal effect in the body. Next slide. This is the overall mechanism. This is a very complicated mechanism, but I have prepared this picture that how to regulate the immune mechanism of the regulation of the immunity in viral infection by the vitamin D. So we already know the pathophysiology of vitamin D, that vitamin D is an inactive form and is activated by 1,25 dihydroxy vitamin D in the body, and 1,25 dihydroxy vitamin D in the body, it attached with ACE2 receptor. and the inhibition of the ACE2 receptor by vitamin D3, it reduces the angioedema, it reduces the stress, it reduces the ER protein in the VDR. So the reduction in the VDR receptors, it gives a anti-inflammatory effect. It reduction in the VDR receptor, it reduces the neutrophils, lymphocytes, and complementary proteins. And it also reduces the non-specific antiviral responses. So the sufficient vitamin D in the body. So the presentation is also, this slide is also give information that that if sufficient vitamin D in the body is there, so it have to also it will be help to reduce the viral load by increasing the viral clearance from the body in the form of feces or in form of urine or in any form of the body. So the deficiency of vitamin D, it reduces the ACE2 receptor and vitamin D related gene polymorphism. Also it induces the angioedema or ARDS, that is the acute respiratory distress syndrome. The acute ARDS, it also, I already discussed, the cytokine storm is there. So the deficiency of vitamin D, that plays a major role in in reducing the immune response, and that the body doesn't fight the viral infection in the body because our environmental condition is very harsh. And some we can differentiate the actual symptom between a viral flu and a COVID-19. It's like the same symptoms. So but I suggest that proper vitamin D supplementation is very necessary for the body to fight against the infection. So like now this time weather is very like a very stable weather, and people can take vitamin D from sunlight, because the overall radiation, we need a radiation of less than 200 area per centimeter square is very good for our body. So I have recommended my audience also and in the world to take vitamin D in the form of cabbage, in form of sunlight, in form of supplementation to fight against this disease. So next slide, ma'am. So I already discussed because this is the picture is quite complex, and I have to write some points on the mechanism of regulation of vitamin D by viral infection by vitamin D. That I already discussed that immune cells, they have known to express vitamin D receptors, and various other immune cells like monocytes, macrophages, beta cell, and T cells, which induces the immune response. They are capable of converting 25 hydroxy vitamin D to active form 125 hydroxy vitamin D, that is vitamin D3. This permits local regulation of local regulation at the site of inflammation. So binding of this vitamin D to VDR, it leads to translocation of the complex to the cell nucleus, where it modifies the expression of hundreds of genes, including those for cytokine production. This complex induces the production of antimicrobial peptides into calcitonin and calcitonin. Vitamin D can also decrease the production of helper Th1 cell cytokines such as interferon alpha and tumor necrosis alpha. Also, expression of pro-inflammatory cytokine by macrophages is also reduced, and anti-inflammatory cytokine is increased by vitamin D administration. Vitamin D has also been demonstrated to be a strong inducer of autophagy, and study by Campbell. It's a latest study. It reported that inhibition of HIV replication in macrophages via vitamin D3 induces the induction of calcilycidine, perhaps by enhancing the autophagy and phase somaya maturation. Next slide, ma'am. So previously I have discussed the pathophysiology of vitamin D, and what are the actual mechanisms of regulating the immune response of vitamin D to fight COVID-19. So I now have some slides of epidemiological status, that if the predicted research is actual or it's like a theory. So we have, because of the epidemiological status, people have done the screening of various people around the world, and it so the predicted COVID-19 rates because of the vitamin D levels. So those with the deficiency of vitamin D status have double the disorders. It double the viral load, it double the viral clearance of 21.6%, and those with sufficient vitamin D studies have lowered the rate of COVID-19 mortality and COVID-19 rate. So it's a huge difference. It's like around double or twofold high those with vitamin D status deficiency. So people, we should have to take vitamin D in the food or in the supplementation or in form of sunlight to tackle this disease. So next slide, ma'am. So this is also the epidemiological status that what the actual levels of vitamin D levels among adults with or without COVID-19. So with the levels of 14.4 nanogram per ml in blood, they people admitted to ICU. So there are three types of vitamin COVID-19 cases: mild, moderate, or severe. So what actual the factors? Because many people they are recovered, many people they are died due to COVID-19. So I have seen the people which have recovered from COVID-19 around 2 to 3 days. This is very good, and I have seen people with very good body or a very good tone. They have because they have died due to COVID-19 in 14 to 17 days. So what is actual the mechanism? What actual the role? Because it's a vitamin D is a major role. So the less vitamin D in the body, so people they suffered from COVID-19, they have admitted to ICU. They if the vitamin D level is 2.4 nanogram per ml, they have admitted to hospital but not ICU. They have recovered between the 14 to 21 days, and though people have the vitamin D levels 30.3 nanogram per ml in blood, they have shown mild non-respiratory symptoms. They have recovered within 5 to 6 days. They have not shown any symptoms like fever, cough, or others. They have been recovered. So the people they have vitamin D levels of 25.4 nanogram per ml. They have controlled. They have shown almost no symptoms, or they have shown mild symptoms. They have been recovered within 5 to 6 days by taking some hot water or by taking necessary precautions. So they have been recovered. So you can see that from the graph that vitamin D plays a major role in fighting disease. So next slide, ma'am. So this is a recommended dose for vitamin D3. I have discussed the epidemiological status. So what I have to recommended doses for vitamin D, that if the age is less than 1 month of age, that is a neonates, that we need a dose of 100 international unit per day, or in that infants have less than greater than 1 month age, they have needed the recommended doses of 2000 to 3000 international units per day. The children and the adults of age 1 to 18 years of age, they have needed the vitamin D dose of 3000 to 5000 international units. For adults, dose around the people like 20 to 40 years of age, they have needed the dose of 7000 to 10,000 international units per day, or 1250 microgram per week. So next slide, ma'am. So this is the my paper publication that already this paper that has been published in that vitamin D levels and COVID-19 susceptibility, is there any correlation? That paper has been published in Medicine and Drug Discovery around the impact factor of greater than 5. So this is a very good publication. I had been readily been cited by the various scientists in the world. So I am thankful to those scientists who cited my paper, and I am thankful to the audience for listening this. Next slide, ma'am. So the presentation conclusion is that death of treatment of COVID-19 leaves us with no choice, but to take precautionary and prophylactic measures to stand a better chance to fight this pandemic. Hence, maintaining adequate vitamin D levels is vital to prevent and getting infected or to ward of the infection without mortality in case it occurs. Clinical trials should be conducted in regard to COVID-19 for assessing the effect of vitamin D supplementation and determining the appropriate dose. We conclude that the correlation exists between vitamin D levels and COVID-19 susceptibility, and vitamin D could prove to be an essential element in fight against the COVID-19. So next slide, ma'am. I think it's the end of the slide. So this is the overall reference that I have been taken. So next slide, ma'am. So it's a thank you all. This is a thank you for very much for the listening of my presentation. Ma'am, can you hear me?
Yeah, thanks a lot for your presentation. And yeah, it was informative. And yeah, just give me a second. We discussed. Okay, yeah. So, do we have any questions for Dr. Dilpreet Singh? I guess there are no questions. Thanks a lot for your time, Dr. Dilpreet Singh. And yeah, I'm
And
really sorry.
if there is no question or if there are multiple questions, means the people have been understand well or they have not understand. So
It's because they might have understood because your presentation was really very like understandable. It's nothing like complicated. Like, you have explained it in a very easy manner. So yeah, it is easily understandable.
so thank you, madam. And can anything left for me, ma'am,
No,
for
no, no,
some
no.
some other official notice or other thing about the conference?
No, 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 nothing is left out. So yeah, thanks a lot for joining the webinar and making your presentation even with your busy schedule. As you said that you're having some uh, marriage at your home. So yeah, all the best for that. Yeah, thanks a lot for joining.
So can I get a certificate or
Yeah, you
some?
will be sent an email with the certificate one after the commencement of the webinar. You will be sent an email.
Okay, thank you, madam. Okay.
Thanks a lot. So yeah, moving on to our next session, we have Dr. just- yeah, we have Dr. Gerardo Guillén from Center for Genetic Engineering and Biotechnology, Cuba. So your screen is visible to us, Doctor. Yeah.
So, are you hearing me?
Yeah, we can hear you too.
Okay, let me put my presentation
Mhm.
in full slide. Trying to open full screen
Uh,
because
okay.
it's blocking the panel of the
It's only visible to you and it's not visible to us, so don't worry about
uh,
it. And
uh,
also beside 65% at down bottom right corner, you
I,
have
I send
16% and
I send my presentation by email to
mhm.
you. Probably you
Okay.
can load for me.
Yeah, sure, I can do that. You can send it to us.
I already sent.
Oh, you already sent. Just give me a moment. I'll just check that out.
Mhm.
Uh, Dr. Gerardo, actually, we haven't received your presentation. Could you please resend that to us again so that I
Okay.
will just check it once
Yeah.
again?
I'm sending to you to Jennifer. Yes.
Yeah, you can send that.
I'm sending again. Are you already sent?
Yeah, I will just looking for it. Just give us 2 minutes. Yeah, we'll just look at it. You can once again click on screen button so that you will not be able to share your screen with us.
Okay, I close this screen.
Yeah. So just give us a moment. I'm just checking our email and we'll just let you know. We have received your presentation. Just give us a moment. I'm just downloading the file. Just give me 2 minutes. Yeah, can you please
And
check this? Is that okay,
yeah.
Dr. Guerrero?
Yes, it's okay. It's okay.
Yeah. Mhm. Please let me know when to change the slide so that I'll do that for you.
Okay, you can start. So
Oh,
this is, could I talk?
yeah, you can. Please continue.
Well, thank you. Thank you for this opportunity to share our result with you. My name is Gerardo Guillén. I am the Biomedical Research Director at the Center for Genetic Engineering and Biotechnology in Havana. And I am introducing my talk about innate immunity potentiation with a nasal interferon formulation and is with a new mucosal vaccine. So it is very important in our times with the ongoing pandemic to induce innate immunity and to potentiate innate immunity, not only against coronavirus disease, but also against other respiratory acute infection that can be confused with coronavirus. In this way, in Cuba and in our center, we have been working in several projects, and among this project, we have two projects direct to the potentiation of innate immunity. And one of these projects is a new formulation of interferon for nasal administration, alpha interferon, and another is a vaccine that we redirect with reprofile. Originally, this vaccine was developed and is registered in Cuba for chronic hepatitis B, but as you will see, we are using the capacity of this formulation to potentiate the innate immunity. So you can pass the slide, please. The next.
Oh, I'm unable to change the slide. Just give me a moment. Yeah, it's done.
So this is a nasal formulation that was special developed to fight against this epidemic, because before we were producing the injectable interferon that is broadly used in the national protocol for the treatment of coronavirus disease in Cuba, but this was special nasal formulation that was designed mainly for prevention of the medical personnel and population at risk. The next. So this is electronic confocal microscopy and electronic microscopy, scanner microscopy that we were using to show the conglomerate of the virus at the mucosal level. Here in the left, you can see the normal mucose, normal trachea, and in the middle, you can see the viral conglomerate in the trachea, and in the right, you can see the conglomerate of virus at the lung. So this was an asymptomatic patient. That is why it's very important to prevent the transmission even in asymptomatic patients. So, and we are using this nasal interferon to prevent the infection in personnel and risk and also in contact of a positive COVID patient. The next one. It has been very broadly published in different journals about the importance of the early innate immune response. And the main cytokine responsible for early immune response is interferon, alpha interferon. So it's broadly accepted the advantage to use interferon early or before the infection to prevent the development of severe disease. So there are several types of interferon, alpha, beta, gamma, type 1, 2, 3 interferon, also lambda interferon, but alpha interferon is the main molecule responsible to stimulate interferon-induced genes and also to activate adaptive immune system. Next one.
I'm sorry to interrupt, Dr. Guerrero. We are unable to listen to you. Your voice is not audible to us. Dr. Guerrero, are you still available online? Dr. Guerrero, we are unable to listen to you. Your voice is not audible to us. Could you please just check your mic setup? I'm sorry, your voice is actually not audible. Just give me. Oh. mm. Could you please try on without your headset or headphones, anything? Maybe with the direct speakers, you can just give a talk. Could you please try those? Mm. Are you able to hear me, or is there any technical issue? Maybe you could just log out and log in once so that we can just check if there's any technical issue. Dr. Guirado, could you please on your camera once if possible so that we'll just check if there's any technical issue or anything? Or maybe you could just log out and log in once so that we can just check because I'm completely not able to hear you anything. I could only see you online. That's all. Dr. Guirado, are you able to listen to me at least? Or oh, I've actually sent you a message. Could you please check in the chat session so that I'll at least know if you're online or not? Because it's pretty confusing to know if you're online. Dr. Guirado, are you available online? Because we cannot hear you anything. Just want to confirm if you are connected with us. Maybe you can just log out and log in once again so that we can continue with the session of your presentation. Dr. Gerardo, hi, we are unable to listen to you. Please do at least once on your camera to let us know if you are online or maybe the network got disconnected because we are unable to trace out. Dr. Gerardo, can you hear us now? Your voice is not audible to us. I'm so sorry for the technical issue. Dr. Gerardo, could you please just check with your headphone or head devices, like whatever you're using, or you can just remove it and give the permissions for your speakers so that you can just directly talk or
Are
anything.
you hearing me now?
Yeah, it's perfect now. Yeah, we can hear
Please.
you.
Are you hearing me now?
Yeah, we can hear you.
I cannot hear you.
Oh, we can hear you. Dr. Gerardo, we can hear you actually. Dr. Gerardo, we are not able to listen to you again. Oh my God. We're not able to listen to you again. I'm so sorry. We were actually able to listen to you when the camera was on. Again, now we are not able to listen to you. Dr. Gerardo, we are again not able to hear to you.
And
This
in humans,
conference will now be recorded.
in animals and in humans, when you challenge or the person is infected with the coronavirus, the interferon gene have very low expression. And if you administer, you treat with interferon, you can overcome this insufficient induced by the virus. So the next slide, please. Here, we were administering interferon, the nasal route of interferon. It was a 20 million unit preparation in 2 milliliters. We administered 2 drops in each nasal cavity, and after 30 minutes, 45 minutes, we were able to measure interferon in blood. Is that which we are showing in this figure down here. And in the right figure, you see the activation, and in peripheral mononuclear cells, the activation of several induced interferon biomarkers. Oligoadenylate synthetase 1 that induce the RNAs that degrade the RNAs, the genomic of the virus, and the toc-like receptors 3, 8, and 7 that are activated by RNAs. by RNA virus. It's a marker, is a pattern, repetitive pattern for activation of innate immune system. Next one, please. And here you can see the activation of lymphocytes and monocytes. So the relation TCD4 and CD8 cells is induced after 72 hours after starting the treatment with nasal interferon. The CD19 marker, that is a marker of activation of B lymphocytes. So, and the monocyte activation, it's a marker in the right panel, is a marker of with HLA-DR receptor that is also activated. All these markers are significantly activated in monocyte and lymphocyte. Next one, please. And this was a phase 1 clinical trial that we conducted in only 1 day. So after 1 day administration of nasal interferon, we were able to measure the activation of oligodenylase synthetase in 97%. So where totally 40 volunteers were treated, and 39 out of 40 volunteers were able to show activation of oligodenylase synthetase. The same happened on day 3 and day 5. And even after the end of treatment on day 16 and day 23, 25 out of 40 volunteers still have oligodenylase synthetase biomarker activated. The next one, please. Here we are showing the same. So it's in this bar you can see the rate of activation. So it's in the rate several times activation of the oligodenylase synthetase 24 hours after starting the treatment, 72 hours, and 120 hours after starting the treatment. So the median activation of the gene was almost 3 times. Next one. And this table here summarizes the treatment. More than 164,000 people were treated with this formulation of nasal interferon, mainly risk group. Here in the first line is the brigade Henry, that are the teams of medical doctors that are going to around 40 different countries to fight against coronavirus diseases. And as you see, only 1.5% of this brigade, that are almost 4,000 people, only 1.5 of these medical doctors were infected with the virus. We also treat vulnerable people, that is all people older than 85 years, and 100% were in principle protected. So they were not infected with the virus, even they were contact of other positive people. And in medical personnel in general, only 0.7% of medical personnel treated with the nasal interferon was infected, and only one patient progressed to severe disease. So he gone to the intensive care unit. So all the other infected patients, that were 630 patients, they have only mild disease. The next one. So this was another clinical trial that was conducted in using this formulation in hemodialysis patient, and was very safe. And these patients were not infected also, but this was a small cohort of patients. Next one. So as a conclusion, we can tell you that interferon, a nasal administered interferon, was able to pass to the blood circulation, to peripheral blood circulation system in only 30-45 minutes and induce significant elevation of innate immune markers, both at mucosal level, detected at oropharyngeal level, and at the peripheral blood. Both lymphocytes and monocytes were activated, and this activation lasts for at least 10 days after the end of the treatment. So in the next slide, we'll switch to the another vaccine. In this case was interferon. Now, in the next slide, I will talk about the nasal vaccine formulation that we also developed to fight against the epidemic. Next slide, please. So this was trial conducted at the Luis Diaz Soto Hospital, that is a main hospital treating COVID patients in Havana. Next one. So, as I initially was telling, in this case, we reprofile a already existing vaccine, that is a vaccine that developed by our center, the Center for Genetic Engineering and Biotechnology, for the treatment of chronic hepatitis B. It's a vaccine, it's a therapeutic vaccine against chronic hepatitis B. Next one. This vaccine was registered in Cuba since the 2015 year. So, and this in the left you can see the virus-like particle expressed in E. coli that contain this black blood in the center of the particle is RNA content. So this particle is very rich, more than 25% content of RNA. So it's at the time that you use this vaccine, you administer this vaccine, it's remain as a virus, it's a virus-like particle, and it activates innate immune system using the same repetitive pattern for activation of innate immunity that contain the virus, that is the viral genome. So, and this RNA is able to activate toll-like receptors 3, 7, and 8 that recognize RNA. Next one. No. It's well known that all people in the elderly, the capacity of activation of innate immunity is reduced, and that is why all people are more susceptible to infectious diseases and especially to acute respiratory infectious diseases. And in the case of coronavirus, the mortality is higher in the elderly. That is why it is important to protect elder people and to use this kind of formulation of interferon or vaccine to activate the innate immunity and as a preventive measure. Next one. So here we are showing that in the presence of the virus or in the presence of activator of innate immunity, the antigen-presenting cells maturate and present a HLA receptor able to activate immunological system. Next one. So the design of our first trial was in volunteers that were hospitalized and they were contact of positive people. So we have a control group that have a basic treatment, a national protocol for treatment that is was established in Cuba, and another group that in addition to the basic treatment protocol, also use the vaccine. Next one. So the vaccine was very safe. So we administered one nasal spray. In this case, was a spray at first day and after 7 days. So 2 times, first and 7 days, and then we also administer daily drops by a sublingual route. So it was nasal spray and sublingual drops of the vaccine every day. On day 1 and 7, nasal spray, and the other day, up to 14 days, was sublingual administration. Next one. And here we are showing the activation of toll-like receptors 3, 7, and 8, and down in the right figure is the activation, the statistical measure of the activation of the 3 markers at the same time. As you see, was very significant activation of toll-like receptors. This is an oral pharyngeal scraping, so it's at the mucosal level. And next one. Next one is the same markers, toll-like receptor 3, 7 at A, but at peripheral blood. So you can see also significant activation of all the markers at peripheral blood. Next one. And here, this slide show you the activation of monocyte. So HLA-DR receptor is significant activated only after 4 days of treatment. So it means only with 1 nasal administration and 3 sublingual administration, already we have significant increase of activated monocyte. The next one. And the same at the lymphocyte level. So it's a significant activation of HLA-DR receptor only after 1 nasal and 3 sublingual administration. We have significant activation of lymphocyte. Next one. As a conclusion, we can summarize that the vaccine, the therapeutic vaccine, is called, the trade name is Hevernasbat, and the trial and the COP of this reprofiling to activate innate immunity we codify as CIGB 2020. So this vaccine induced an increase in the gene expression of toll-like receptors 3, 7, and 8 at the local site, and stimulate the expression of HLA class II in monocytes and lymphocytes in systemic circulation, it means peripheral blood, evidencing a superior condition of immune system of aged patients to respond against coronavirus infection. So as a result of this trial, we were able to submit to our regulatory authority a phase 2 trial in early positive patient as a post-contact treatment to activate innate immunity. Another trial for prevention is it will be intervention with more than 2,000 volunteers in different communities, and this trial should start very soon. So next slide. In the next slide, I want to thank all our collaborators for hospital, Luis Diaz Soto Hospital, that were conducted this trial, and also all the collaborators from our center that were involved in the measuring of all these biomarkers. So thank you very much for your attention, and I'm very sorry for the connection troubles that we have during the presentation. Thank you.
Thank you for your presentation, Dr. Guerrero. Can you hear me?
Yes, perfectly. Now it's
Oh,
perfect.
that's great. Yeah. Thanks a lot for your time and your patience. And yeah, we are really sorry for the inconvenience caused. But yeah, anyway, successfully we have completed the presentation. So that's good to know.
Fortunately, thank you. Thank you very much for all your support and your patience, your
No, thanks
patience.
a lot. Thank you. Have a great day. So yeah,
Thank
do we
you.
have any questions for Dr. Guerrero? I guess there are no questions. So yeah, thank you. So
Thank
with
you.
your presentation, we end our webinar of day 2 sessions. So thank you one and all. So we'll be sending you the certificates through email, and we really hope your support for further conferences and the webinars too. Thank you. Thanks a lot.
Thank you. Thank you. Bye bye.
Bye bye.